The appendix is a long, thin pouch shaped like a finger that hangs down from the large intestine. Appendicitis is a name for when the appendix gets infected and inflamed. If that happens, it can swell and sometimes burst. That's dangerous because a burst appendix can cause infection in the belly. What symptoms will you experience with appendicitis? Severe pain in the lower part of the belly on the right side. For many people, the pain starts near the belly button and then it moves to the right lower side. Loss of appetite, nausea, sometimes vomiting, fever, and diarrhea. How do we diagnose appendicitis? We can learn a lot about your condition by pressing on your belly and talking with you about your symptoms. If you're not certain after the exam, we can do imaging tests to see what is causing your symptoms. The most common imaging tests to diagnose appendicitis are a CT scan, which is a special kind of X-ray, and an ultrasound, which uses sound waves to look inside your belly. How do we treat appendicitis? The main treatment for appendicitis is surgery to remove the appendix. Laparoscopic surgery is the most common technique, in which we use 3 small cuts in the abdomen. We then insert long, thin tools into the belly. One of those tools has a camera called a laparoscope on the end, which sends pictures to a TV screen, which we can then look at those images on the screen to know where to cut and what to remove. You can treat appendicitis with antibiotics as long as the appendix is not blocked or burst. But without surgery, there is a chance that your appendicitis will come back again. So surgery is still the best treatment, unless you have very severe medical conditions. If your appendix has burst, but it has been a few days since this has happened, you might decide not to do surgery right away. In this case, we will probably give you antibiotics and watch you carefully until you are well. The body can sometimes form a wall around the appendix to block off the infection. This is called an abscess. If an abscess forms and you didn't have surgery, a drain may be placed to remove the pus. However, you will still need surgery later to remove your appendix. And that's because at least 1 in 10 people with a burst appendix have a tumor in their appendix. What are the risks of an appendectomy? Wound infection 1%, ileation 3%, and less than 1% people get bleeding, pneumonia, or injury to nearby organs, or an abscess.